The growing crisis across Canada's healthcare system and emergency departments having to close because of staff shortages, case backlogs. We're going to focus for the next few minutes on Prince Edward Island. The problem there, a growing lack of doctors.
Now we'll have to go to a clinic, and we'll have to sit at a clinic 2 hours before the clinic even opens just to get a prescription for our son that's 8 months old.
That is one concerned mother. Her doctor is leaving his practice, and his departure makes 4 doctors in Charlottetown who have left practices and patients in just the last month. It's an issue that is preoccupying Health PEI, and someone we know well on this program is the Chief Executive Officer of Health PEI. That's Dr. Michael Gardam, who's giving us some time today from Charlottetown. Good morning. Nice to see you again, Dr. Gardam.
Yeah, good morning. Nice to see you.
You know, this really caught our attention. Fourth doctor in a month. What is happening?
Yeah, well, you know, it's very sad, but this was kind of predictable, to be very honest with you. Being a family doctor these days is very, very challenging. We've known that for a long time. It's a hard specialty in medicine to do. And then throw a pandemic on top of it, and then throw a relatively rural area where it's harder for us to recruit doctors than, let's say, larger centers in the country. And you end up with doctors who are tired, burned out, they're frazzled. And what really strikes me with these doctors leaving in Charlottetown is, for the most part, they're not leaving the island to go practice somewhere else. They're leaving family medicine.
Totally.
And so it really speaks to, this is a national issue with family doctors right now.
And I want to look at the national context. I'm just wondering, though, too, 4 and counting, you issued a statement at Health PEI indicating you seem to think there are more departures to come?
Yeah, well, we know that, you know, the Canadian Medical Association did a survey of doctors across the country, and there's no doubt that there's a very, very high level of burnout here on the island and elsewhere in Canada. We also have one of the oldest doctor populations in the country. And so, you know, we predict there will be people who are taking this moment to decide to retire. So I think we're not going to sugarcoat this. This is a real problem for us. And truly, my heart goes out to islanders who have lost their family doctor, because there is no easy, quick fix for this. We're going to have to rebuild over the next few years, but we're not going to be able to turn this around in a month.
So the islanders who are now in a real situation, 24,000 of them on the waiting list for a doctor, and this is in a province of only about 165,000. So it's a high percentage. What do they do? Where do they turn right now then?
Yeah. Well, I mean, the big thing that Prince Edward Island has done, and this was done before I actually got here, is we offer everybody without a family physician access to Maple, which is one of these virtual online services. So people can have access through that, which allows them to get prescriptions renewed, et cetera. It's all virtual. And PEI was actually a bit of a pioneer in that kind of technology. We have walk-in clinics, but I'll be honest, they're not great. And of course, the last place we want people to go is the emergency departments, but obviously that's an option as well. None of these things are good. I mean, one of the things that we're trying to do is we've been moving very aggressively towards the concept of medical homes, where doctors are part of a larger team with nurse practitioners and other healthcare professionals who can help take some of the load off the doctors and allow us to care for more people. We're actively moving towards that, but again, the challenge is recruitment.
Sorry, I want to get to recruit, but I just want to, you raise the emergency department. I think I better ask about that too, because we've been talking about so many provinces where hospitals have actually had to shut down temporarily, at least close, turn people away in emergency departments because they just don't have the staffing capacity, because so many people are showing up at ERs, and obviously with no family or fewer family doctors, that's a reality on the island as well. Have you had to respond in kind in your hospitals on the island?
Yeah, absolutely. I mean, we have 2 main emergency departments on the island, one in Summerside, one in Charlottetown, and we have to protect those emergers at all costs. But what that means is we do have smaller rural emergency departments, and over the course of this summer, we've definitely had days where we've had to close early, or we've had to close them for the day. Not so much because we're redistributing staff, but because we're so tight on staffing that one person ill is enough to put that shift in jeopardy. So, that's the reality of our system.
Yes.
We have no illness. And on top of all of this, the reason we've gotten into real trouble this summer is because there's been a considerable COVID resurgence as well. So we have over 100 staff off now with COVID at this very moment. And I don't see an end in sight for that either.
Okay. It's just an incredible perfect storm as we look at the island situation, as you've said, nationally. But island in particular, why the great challenges in recruiting there? It's such a beautiful place.
It's such a beautiful place, not so much in the winter, but in the summer it's lovely. I think that, there's a lot of systemic issues that have been going on here for years, and systems that were put in place at a time when there were lots of doctors around. And so the system was almost designed to keep doctors out. We have to fundamentally reform that system, and I'm working very closely with the government here. I'm hoping to essentially blow it up and start over again to make it very easy for us to recruit doctors. Right now, it's actually very challenging. If I compare what I used to do in Ontario compared to here, it was much easier to recruit in Ontario. And that puts us behind the 8 ball, on top of the fact that it's always harder to recruit to more rural areas. So we need to get our act together as a system, as well as fixing a lot of the things within Health PEI to make sure that our doctors are feeling supported.
But it sounds like, we just had national meetings with all of the provincial and territorial leaders. It is a national system that maybe parts need to be blown up and rebuilt, as you said. And there's a lot of talk about poaching from within provinces and other parts of the country. So as you talk to your former colleagues from Ontario and people across the country, what are we looking at as the national picture right now, and what do you think has to be done?
The national picture is really pretty dire. And I think the frustrating thing about all of this is that this, again, was predictable. We've been living on this dream that Canada's healthcare system is second to none. It's better than the US, but compared to every other developed country around the world, we don't perform as well. And so we've slowly gotten into this mess, and then the pandemic sped everything up. There's no doubt that obviously we need to recruit more family doctors, but the reason we're not able to is because a lot of doctors don't want to become family doctors, because the environment just isn't one that they're going to really be happy in. And so, one of the things we're doing here, as I said, is creating these large teams. Other provinces have done that as well. That's seen as the future. The most risky position is a solo doctor in a solo practice who, when they get sick or they retire or they leave, everybody's out of luck. Whereas if you're part of larger teams, we can all support each other. So that's clearly a thing. As was recently mentioned in an op-ed in the Globe and Mail, paying people salaries rather than fee-for-service is another way of making it more attractive. We've already been doing that on the island. We really have to look at family medicine as a whole and say what we're doing isn't working, and it's not enough to just say we need to fix it. We actually need to get our hands dirty and really get in there. Unfortunately, that is what we're trying to do here on the island. It's one of the advantages here, having such a small system. It's one of the things that got me interested in working here, is that we should be able to fix it here. And so that's what we're working on.
And maybe practices that others can emulate, looking at as you fundamentally reshape healthcare in the smallest province, other provinces looking as an example. Dr. Gardam, so good to hear your voice on this. Obviously, this is an issue we must keep full attention on. Thank you for the time today.
Oh, thanks so much for having me.